So this is Leanne Mitchell recording my final reflection for my DNP project and the DNP program at Frontier Nursing University. It's hard to believe that I'm actually here at this point. And as I look at these course objectives and think about what I need to reflect on, the first one is to evaluate a rapid cycle improvement project over time. And I think that is a really interesting way to think about what all we've accomplished. In many ways, I think the planning part is the hardest part, trying to figure out exactly what you're going to do. And it's been interesting as I look back and see how that evolved. You actually have to be in the trenches doing the project to realize, oh my gosh, why did I think that would work? That's never going to work. And then implementation is probably actually the easiest because you get to do things. And as you're doing, you get to change things that don't work and continue to do things that do work. And then as you move on to the dissemination, when you get to talk about it, then you're like, okay, so what do we need to do going forward? And what would I change if I was going to do it again? So I think as this project progressed, I've learned a lot. I learned a lot about myself and about my team. And we'll get onto that in a minute when we talk about what the messy parts were. So when I think about disseminating improvement findings in both oral and written formats, I've always been able to be I've always been a really good writer. I'm used to writing reports. This stems back from when I taught nursing. I had to write a report for the Board of Nursing every year. I've graded more papers than I can imagine, so that really did not bother me. I enjoyed using the square format. I think it was an excellent framework for providing that. As far as my presentation goes, that was probably, well, I'm very comfortable presenting and lecturing. I didn't like being tied down to one spot. One of the comments was, you need to not sway. Well, when you're used to being able to walk around, walk in front, point to things on a board, having to stand in one spot so the camera on your laptop can capture what you're saying is really hard. It was really hard for me. But I do think the presentation went well. I think it's very interesting. Probably the most nervous I've ever been because I was presenting in front of people I have to see every day. So that makes it hard. When we move on to, that kind of segues into leading an interprofessional team. My team is really small. And the fact that there's really only 2 professionals in our office, in some ways made it easier, in some ways made it harder. Because they were really willing to do what I asked them to do. But a lot of times they didn't have enough knowledge to challenge something and say, well, hey, why don't we try this? It was more of, okay, well, that sounds good. We'll do it that way. So I think it would have been a far different project had it been in a larger practice setting with a team that had, say, even more licensed providers or more licensed support staff. And how have I developed skills to function as a practice specialist? I like things like this. I like to do investigations. I like chart audits. I like seeing where we're at and seeing where we can go. The issue is where I currently work, there's not probably much support or call for that. It is a very small practice. So I do think I have good skills. I think this has helped me to grow those skills, and maybe in the future I'll get to use them more. So let's look at some of these questions from Dr. O. What are the messy parts? I think the messy parts are when one of the messy parts was, my team is very small. They know each other. They can fight. And then sometimes they just look at you, well, I don't think we need to continue this because what if the lab doesn't give us enough glucola drinks? So sometimes their knowledge level is not high enough to understand that just because of something not necessarily trivial, but inconsequential shouldn't affect how you treat your patients. So that's, I think, a very messy part. Challenges to my integrity, value, and sense of purpose. I don't know that I see any challenges. other than I almost feel like I don't have a purpose now because I'm not doing this project. So how do we move forward from that? So I think how I take that forward is in talking with the students that I have in my office, because I seem to always have a student, and to encourage them to think about quality, to think about how they are taking care of their patients, to think about costs, to think about patient costs, to think about cost of the healthcare. You know, do you really need to run an MRI when an X-ray will do? And things like that. And then just like we had a situation the day we had a Medicare patient, she was concerned about how much a prescription would cost. And while $40 may not seem like a whole lot of money to a lot of people, it was a lot of money to her. So those are some of the things I hope as I move forward I can pass on. And where do I see myself in 5 years? I hope to be continuing to practice and possibly teaching in some form or fashion. I think that's the best way we can continue to learn, is if we, number one, if we teach, and number two, if we challenge ourselves to do that. Thank you all very much for this experience.